There are 150 professions in hospitals, all working for life. Such was the campaign slogan from the French Health Ministry. Some will appear, others will disappear. The pastry maker was eliminated in 2008 from the list of professions. The IT and robotics people will appear. There is a lot of talk in France about these new professions, but the public administration is ambivalent. The profession of dosage specialist is presented by the ministry as a job of the future, but the job already exists. Somewhere between the radiologist and the X-ray technician, it just doesn't have an official status. And so we hear that hospitals cannot recruit them, but it's absurd. These missing links are quite common in France. Between the nurse, who has trained for 3 years after high school, and the physician for 12, there is a no man's land. In Anglo-Saxon countries, the delegation of tasks has shown its value. In Canada, Great Britain, and the US, there are nurse practitioners. Neither physicians nor nurses, their job extends beyond nursing to medicine. With 6 years of studies, these first-line nurses provide a diagnosis, recommend a patient to a specialist, and write prescriptions. All of this exists since the 1970s in France. In France, nurses were not authorized, nonetheless, to prescribe until 2007, and only for equipment. When will X-ray technicians be able to do sonograms, or nurses do endoscopies and thyroid exams? These are common abroad and not even in the experimental stage in France. In 2007, the French High Health Authority recommended the expansion of the role of nurses. We are still waiting, and not without hypocrisy, because many physicians already delegate many tasks to nurses in complete illegality. For the more technical professions, the problem is quite similar. Painters, plumbers, carpenters. The hospital has everything you need to repair a 19th century building. But who will take care of digital pipes and images? Neither the IT team nor the biomedical engineers. It's not their job. So to organize a simple video conference, it's DIY, do it yourself. So who is surprised that telemedicine has only taken baby steps in France compared to Norway? In Norway, the distance from the nearest regional hospital can be as great as 800 kilometers. Necessity is the mother of invention. By the 1980s, telemedicine was used in Norway to follow diabetic patients and pregnant women. Ear, nose, and throat consultations are now possible as well. We could multiply the comparisons. In terms of technological and professional innovation, France is behind. But is there a real will to catch up?